Hey guys, did you know that irregular or abnormal bleeding is one of the most common reasons women visit the gynecologist? So you may be somebody with a fairly regular cycle, 21 to 35 days, with a period about 4 to 5 days long. But if you are somebody who's bleeding outside these parameters, so you're spotting every couple weeks, or you're bleeding for 7, 8 days, or your period is coming every 2 weeks, this is not normal. And there are many reasons why you may have abnormal bleeding. So I just wanted to highlight a few. Number one, fibroids can definitely cause bleeding. I'm the fibroid doc, so I talk about this all the time, but fibroids can cause heavy bleeding and irregular bleeding. Number two, endometrial polyps, which are fleshy little growths inside the uterine cavity that can cause bleeding. Number three, bleeding disorders. Did you know that this was a thing? There are actually genetic mutations that cause different bleeding disorders where young girls and women can bleed a lot. So this is something to also think about. Number four, endometriosis or adenomyosis can definitely cause heavy bleeding. Number five, infectious causes like pelvic inflammatory disease. Number six, ovulatory dysfunction. So if you're not ovulating regularly all the time, that can definitely cause irregular bleeding. And number seven, actually cancerous cells of the uterine lining can also cause abnormal bleeding. So if you're somebody who's suffering from irregular abnormal bleeding and you can't quite figure out what's going on, make sure you think of these things or,